Well, first, the reason why I've been very critical of the UK government, but not only the UK government, the United States administration and many European countries, is because the Lancet published 5 papers in the last week of January. And those 5 papers tell the story of what has unfolded in the Western world in the recent months. Those 5 papers described a new virus. They showed that this virus was deadly, that it was related to SARS, that it was killing people and that the number of deaths was rising, that patients were being admitted to intensive care units and requiring ventilation. Those papers showed that there was no treatment for the virus. They showed that there was person-to-person transmission. They explained the importance of personal protective equipment. They explained why testing and tracing contacts and isolating people was absolutely key to controlling the pandemic. And they indeed also warned of the pandemic potential of this virus. We knew all of this in the last week of January. But most Western countries and the United States of America wasted the whole of February and early March before they acted. That is the human tragedy of COVID-19. Thanks to the work of the Chinese doctors and scientists working in international collaborations, all of this information was known in January. But for reasons that are still difficult to understand, the world did not pay attention. China's decision to lock down Wuhan showed that the government acted tremendously decisively in the face of an acute emergency. And by taking those actions, China led the world in the response to this pandemic. It was not only the right thing to do, but it also showed other countries how they should respond in the face of such an acute threat. So I think we have a great deal to thank China for about the way that it handled the outbreak in Wuhan. Well, I think China's experience is that you acted quickly and decisively. But I think there is a reason for this. I think that the experience of SARS was a surprise. It took the country by surprise. And I believe that the Chinese government vowed after the first SARS outbreak that this would never happen again. And I have seen over the past 2 decades massive investment in hospitals and healthcare in China, huge investment in universities and scientific research. And that meant that when a new outbreak took place in December last year, it had the scientific capacity and it had the medical capacity to deal with the outbreak. And it also had the political capacity because the country understood that the threat of a SARS-like pandemic posed a grave danger to Chinese society. In Western Europe, we looked at this threat in a very different way. We saw the threat as not being from a SARS-like virus, but being influenza. And I think that because we've thought about the risk of a pandemic being another wave of influenza, we didn't take that threat seriously. We thought that influenza is a relatively mild illness, that the virus could pass through communities and that we could generate immunity, which we call herd immunity, in our country, and that would then protect us. But that was a fatal error of judgment. You got it right, we got it wrong. Well, I'm a huge admirer of American science and medicine, and the doctors and scientists leading the response in America are doing a very fine job. People such as Anthony Fauci, who directs the National Institute of Allergy and Infectious Diseases, and Dr. Deborah Birx. Both of those individuals are very fine people. What is very disappointing is seeing the politicians who are, for example, giving credibility to conspiracy theories, who are promoting treatments that have no evidence to support them, and who unfortunately are damaging the potential and prospects for global collaboration by being so openly critical of other countries, such as China, and organizations such as the World Health Organization. I don't think that's a helpful response. What we should be doing is working intensively together to address the challenge of this pandemic. Dividing countries, dividing peoples is not the way to confront a threat to humanity, which this virus is. I think the innovation of these shelter hospitals was one of the most important elements in your successful defeat of the pandemic in China. The idea of creating temporary, huge shelter hospitals out of pre-existing buildings where you could take people with mild to moderate disease, where they could be looked after, where they could be triaged or referred to other hospitals if they became much sicker. This was a brilliant, brilliant innovation because, first of all, it allowed you to protect your other hospitals to make sure that they did not become overwhelmed with sick patients. Second, it allowed you to create the space for the wave of sick patients that came. It allowed you to effectively quarantine those patients within this shelter hospital, and it provided a very safe space for their well-being. So I think it was a very, very important element of your successful response, and again, an important lesson for other countries to learn from.